Together, we are the LEVONORGESTREL sisters.
You heard it right. I am LEVONORGESTREL, and that is my generic name. I have a lot of brand names, and these are Marina, Plan B, Plan B One Step, My Choice, My Way, and Aftera. Now, this is my chemical name.
Some other drugs like me are classified. I am classified therapeutically as progestin. Progestin prevents pregnancy because it inhibits ovulation and it reduces the amount of cervical mucus and restrictions. Because of this, it makes it unfriendly to the sperm that tries to enter the uterus. I am also pharmacologically classified as contraceptives. Contraceptives are drugs or devices which serves to prevent pregnancy.
My mechanism of action is that I am used as a backup or for emergency contraceptive when there is a failure of birth control, misuse, and to prevent pregnancy after an unprotected intercourse. Hence, I may prevent a person from pregnancy, but I do not prevent a person from STDs. I am a synthetic progestin that prevents pregnancy. I interfere ovulation, fertilization, and implantation. I am only effective when I am used within 72 hours after the sexual intercourse.
Absorption. When I am administered orally, I am absorbed in the gastrointestinal tract. And if I am administered using an intrauterine device, or the IUD, I am absorbed in the endometrium of the uterus. And if I am inserted as a subdermal implant, I am absorbed in the interstitial fluid. The maximum concentration after inserted as a subdermal implant is reached within 2 to 3 days. A dose of 0.75 mg administered orally attained maximum concentration within the hour after I was administered. In women with a normal body mass index or the BMI, the maximum concentration is 16.2 nanogram per ml, while those are considered obese are 10.5 nanogram per ml. The time it takes to reach the maximum concentration for those women with normal BMI is 2 hours, while the time to reach maximum concentration for increased BMI is 2.5 hours. Obese clients may experience my slow and decreased effects in contraception. Distribution. In normal BMI, 1.5 mg determined the mean steady-state volume of distribution of 163.2 liters. In obese patients, the volume of distribution is within the range of 404.7 liters to 466.4 liters. I have a range of 97.5 to 99% range in protein binding, and I am mainly bound to sex hormone binding globulin and the SHBG. I also bound to albumin at a lesser extent. Metabolism. I am metabolized in the liver. I am conjugated and forms melanosulfate conjugates after the oral absorption preparation. I do not undergo first-pass metabolism. My elimination half-life ranges from 20 to 60 hours if I am given as 0.75 mg dose of 1.5 mg. Women with a normal BMI have an elimination half-life of 29.7 hours, while with women with increased BMI have a range of 41 to 46.4 hours. If I am administered orally, approximately 45% of me together with lysotic metabolites, are excreted in the urine. Approximately 32%, together with glucuronide conjugates, are excreted in the feces.
These are my indications. I am used for emergency contraception to prevent pregnancy. Second, I prevent follicle ovulation, fertilization, and implantation. Third, I slow rate of release of gonadotrophic releasing hormone, or the GnRH, from hypothalamus. Thus, follicular maturation and ovulation are prevented.
Contraindications. I am harmful if taken and there is an active thrombophlebitis or thromboembolic disorders, diagnosed abnormal genital bleeding, acute liver disease, benign or malignant liver tumors, known or suspected carcinoma of the breast, history of idiopathic intracranial hypertension, and women confirmed to be pregnant.
My side and adverse effects are as follows. For gastrointestinal, nausea or vomiting, abdominal pain, and diarrhea. For genitourinary, vaginal bleeding, bleeding or spotting between menstrual periods. For reproductive system, breast pain or tenderness. For systemic effects, headache, dizziness, and tiredness.
For administering, the nurse should take a history of the client, monitor blood pressure, especially with pre-existing hypertension, monitor diabetes for loss of glycemic control.
During administering, you should monitor your client if he or she experiences headache, diarrhea, abdominal pain, fatigue, dizziness, nausea and vomiting, breast tenderness, menstrual spotting, and early or delayed onset of menstrual period.
After administering, the nurse should report signs and symptoms of PID immediately, such as prolonged or heavy bleeding, unusual vaginal discharge, abdominal or pelvic pain, painful sexual intercourse, chills, fever, and flu-like symptoms. Note for migraine, if not experienced before, or exceptionally severe headache or jaundice. Diabetics should monitor closely blood glucose for indications of loss of control. Advise client to not breastfeed while taking this drug.
That is it! Now that you have known us, we hope that you have learned something about us. The
Just
LEVONORGESTREL
sisters.
Sisters.
Till the next
Till the
time.
next time.
Bye.
Bye!